Hey everyone, Dr. Mohammed Badreldin here. Welcome to our comprehensive guide on essential medications for major diseases. We're talking about the medications that are absolute game changers for some of the most common and serious health conditions out there. Now, remember, this is just a quick overview to get you familiar with these medications. It's not a substitute for personalized medical advice from your own doctor. Every patient is unique, and so is their treatment plan. With that said, let's jump right in and break down these essential medications, understand how they work, and why they're so important. First up, cardiovascular diseases. These are the conditions that affect your heart and blood vessels. Think heart attacks, strokes, the works. One of the most common is hypertension, or high blood pressure, often treated with medications like lisinopril, which helps relax your blood vessels. Then, we have heart failure, where your heart struggles to pump blood effectively. Medications like metoprolol, a beta blocker, can help slow your heart rate and improve its pumping strength. For coronary artery disease, where plaque builds up in your arteries, good old aspirin comes into play. It acts as a blood thinner, preventing clots that can lead to heart attacks. It's important to remember that these medications often come with side effects, some more common than others. Always talk to your doctor about what to expect and how to manage them. Let's talk about diabetes, a condition where your body struggles to regulate blood sugar. Type 1 diabetes, often diagnosed in younger people, requires insulin therapy. Insulin is a hormone that helps your body use glucose for energy. For type 2 diabetes, which is more common and often linked to lifestyle factors, we have medications like metformin. Metformin helps your body use insulin more effectively. And then there are newer medications like GLP-1 agonists, which not only help control blood sugar but can also lead to weight loss, a double win. These medications are crucial in managing diabetes, preventing complications, and allowing people to live healthier lives. Now, let's take a deep breath and discuss chronic respiratory diseases, conditions that affect your lungs and make breathing difficult. Asthma and COPD are two of the most common. Inhaled corticosteroids are the cornerstone of asthma treatment. They reduce inflammation in the airways, making breathing easier. Bronchodilators, on the other hand, help open up the airways, providing quick relief, especially during an asthma attack. Managing these conditions is all about controlling symptoms and preventing flare-ups so you can breathe easy and stay active. Cancer, a word that strikes fear in many. It's a complex group of diseases characterized by the uncontrolled growth of abnormal cells. Chemotherapy, often using powerful drugs like doxorubicin, targets and kills rapidly dividing cancer cells. Then, we have targeted therapy, which uses drugs like imatinib to specifically target cancer cells with certain genetic mutations, causing less damage to healthy cells. And then there's immunotherapy, which harnesses the power of your own immune system to fight cancer. Pembrolizumab is one such drug that's been making waves. Cancer treatment is constantly evolving, with new and innovative therapies emerging all the time. Infectious diseases caused by bacteria, viruses, you name it, are a constant battle. Antibiotics, like the commonly prescribed amoxicillin, are our weapons against bacterial infections. They work by either killing bacteria or stopping them from multiplying. For viral infections like the flu, we have antivirals like oseltamivir, which can shorten the duration of the illness and reduce the severity of symptoms. And then there's tuberculosis, a serious bacterial infection, often treated with a combination of medications including isoniazid. Remember, responsible use of antibiotics is crucial to prevent antibiotic resistance, a growing global threat. Autoimmune diseases occur when your immune system, your body's defense system, mistakenly attacks your own tissues. Rheumatoid arthritis and lupus are two common examples. DMARDs, or disease-modifying anti-rheumatic drugs, are often used to slow down the progression of rheumatoid arthritis. Biologics, a newer class of medications, target specific parts of the immune system involved in the inflammatory process. Hydroxychloroquine, initially developed for malaria, has also been used to manage autoimmune conditions like lupus, helping to reduce inflammation and pain. While there's no cure for autoimmune diseases, medications can help manage symptoms, control inflammation, and improve quality of life. Lastly, let's talk about neurological diseases, conditions affecting the brain and nervous system. Epilepsy, characterized by seizures, is often managed with anti-epileptic drugs like phenytoin, which help regulate brain activity and prevent seizures. Alzheimer's disease, a progressive brain disorder that affects memory and thinking, poses a significant challenge. Medications like donepezil can help improve cognitive function and slow down the progression of the disease, but there's no cure. Research in neurological diseases is ongoing, and scientists are working tirelessly to develop new and more effective treatments for these complex conditions. So there you have it, a glimpse into the world of medications for major diseases. Remember, these medications often require specific medical supervision to manage side effects and ensure efficacy. Always consult with a healthcare professional before starting any new treatment. This video is meant to be informative, not a replacement for personalized medical advice. Your doctor will consider your individual medical history, allergies, and other factors to recommend the best course of treatment for you. Thanks for watching and stay healthy.